Hello, my name is Vincent Creel, Public Affairs Manager for the City of Biloxi, and this is today's Be Prepared report. This is being recorded on Friday, June 12th, 2020 at 2:30 in the afternoon. The latest coronavirus numbers from the state were not available as this was being recorded, and no new numbers were released by the state on Thursday because of technical issues. What we do have from the Mississippi State Department of Health are the numbers from Wednesday, and they merit repeating. There had been a total of 374 new cases of COVID-19 identified Wednesday. The state also reported 21 deaths on Wednesday. You can see the growth since day one in this chart. The overall total on Wednesday was 18,483 cases since day one, and a total of 868 deaths statewide since day one. This chart shows the daily comparison of new cases reported in the state over the past 14 days. In Harrison County, the numbers were on the increase Wednesday. 12 new cases were reported that day, and 11 new cases were reported the day before. Here's the 14-day numbers for Harrison County. Pay attention to the average on June 5th, a week ago today. It was 2.64. Look at the average on Wednesday, 4.57. We were moving in the wrong direction. These numbers show, even from Wednesday, that the virus is still there. Remember the recommendations. Follow the recommendations. Social distancing, wash your hands frequently, avoid crowds, and yes, if you go to the store, the advice is that you should wear a mask. It's personal responsibility. Joining us this morning is Tom McDougall, the Chief Executive Officer of Merit Health. How are you?
Doing well. How are you?
I've got a question, and it's got to do with these numbers of coronavirus cases. Are you seeing them go up?
We are seeing an increase in cases, but it's tending to be community-acquired cases where people are presenting to our emergency department or to a physician's clinic, and they have really mild symptoms, but they're testing positive for COVID. We're still having few admissions for COVID-positive patients.
We, at one point, weren't counting the hospital admissions as much over here at City Hall, and we've started counting them again. I know you talk to your colleagues. What are y'all seeing in hospitals?
Well, it varies depending on the region of the state that you're located in. Down here on the coast, we're still seeing lower incidences of hospitalizations. They're seeing higher incidences in other areas of the state. That is actually the most important metric. When the original testing started, we were reporting the number of positives and we were reporting ICU bed utilization. And now the most interesting statistic to me and to many of my colleagues that also run hospitals is the number of hospitalizations. And so that's really the metric that matters at this point because it indicates the number of patients with a severity of illness substantial enough to require hospital care.
Now, the biggest thing, of course, about this disease could be death.
Absolutely.
But what is the other thing? I mean, I hear a lot about ICUs and respirators. How does this thing progress in a person that's positive?
We're still learning a lot about the coronavirus cases. And, our team just this morning was laughing because there was a study that was talked about on the radio this morning that bald men are more likely to have coronavirus. Honest to goodness, that was a story this morning. And it's a fascinating time because as we're learning about the coronavirus, and by the way, I don't think necessarily bald men are more at risk.
Thank you for clarifying that.
But just this week we had an interesting story that came out from the World Health Organization saying that in their early studies they were finding that asymptomatic patients were not as likely to be infectious to others. And within 24 hours, they were walking that statement back, saying it's too early, we don't know for sure. And so it's just a constant learning process, and really it's going to take time for us to truly understand the parties that are at risk and the key indicators that help us to indicate when someone may be symptomatic or becoming symptomatic.
This is all when prudence and personal responsibility come into play.
Oh, absolutely. I don't think we've ever had a time when personal accountability for health has been more important than right now. If someone is at risk, if they tend to have risk factors that make them more susceptible to become infected by any kind of virus, much less coronavirus, they need to be very aware of that, make very special precautions, take special precautions. But those that don't have risk factors and they don't tend to get ill, they're probably okay to be back out in the community now. We certainly encourage social distancing and making wise decisions. I was at the gym this morning and was real pleased to see all of my other fellow gym rats in there, and everybody's wiping down equipment and they're keeping their distances and all those things. But I think it's okay for those folks to be back out in the gym as long as we're being cautious.
Give people an idea of the measures that you have in place over at Merit. One of our big concerns has been, and we heard this from you worry about people being afraid to seek medical attention. Give people an idea of what's in place at Merit right now and the things you're doing to make it a safe environment.
Absolutely. That is our number one priority, and we like to use the phrase that we're the COVID safe hospital because of the number of precautions that we have in place. We're doing deep cleaning of all areas on a very regular basis. All of our staff is wearing masks all the time. We're going to continue that indefinitely. Hand washing is constant. I think I wash my hands probably 20 to 30 times a day, and I'm not in a patient care area. So our patient care technicians and nurses, they're probably washing their hands 50 to 100 times a day. So they're very regular hand washing and being exceptionally cautious. We're still have been very pleased with the results where we've had only 1 or 2 employees that have tested positive in this entire time period, which has been amazing. Even the one that we did have test positive, that person had worn a mask continuously. So there was no concern about infecting other fellow employees. So we just use a lot of precautions. When a patient comes to our hospital, they're going to have a certain type of experience. They'll see a lot of signage. When they come into the hospital, the first thing they see is one of our great team members sitting behind a desk, and they're going to ask them some questions about their medical conditions. They're going to check their temperature. They're going to ask them to put on a mask, ask them to use hand sanitizer. It's antimicrobial, alcohol-based that they're going to use. And then while they're in our facility, we ask them just to be very cautious with everything they're doing.
You said patients, but really that's like for visitors
patients,
too,
visitors, everyone. And we have made, I'm glad you brought up visitors. We made a change in our visitor policy just recently where we're now allowing 1 visitor for each patient that's in the facility, whether it's a surgical patient, an admitted patient, a patient in our emergency department. And it has to be an adult, healthy person that's the visitor. And we ask them to follow the same precautions of wearing a mask, washing their hands, doing all those things. It's a recognition of that. We know a lot of people in the community have anxiety about coming to the hospital, and we're trying to help with that by allowing them to have a family member or a friend that they know and trust to be with them.
One thing I found extraordinary that y'all did was if someone is still afraid to come visit someone in the hospital, a family member, you'll make a daily call to them.
Yes, absolutely. We can arrange for either like a FaceTime video conference or
I
a
wasn't
telephone
aware of that.
call.
You're
Yes.
really going above.
Yeah, we absolutely are arranging that. So, if you had for example, if someone was admitted to the hospital and, that's an elderly person and their spouse isn't comfortable coming to the hospital, no problem. We can arrange for a video conference so that the spouses can talk to each other and to also talk to the physician and to the nurses and get all the information that they need.
Another thing that's become popular is telehealth. And I know
Yes.
you have 4 clinics around the community as well. Tell people what telehealth is and why it's something that they should consider sometimes.
Well, by definition, telehealth is the use of technology to connect a patient with a caregiver. It's either a video conference or even a telephone call. That's a form of technology. So we do offer that as an option. So when a patient calls one of our clinics, whether it's one of our specialty clinics or our primary care clinics, they've got the option of either doing a telehealth visit or they can come in and have an in-person visit. So we're offering that, just giving total flexibility to the patients.
And you can find all of those phone numbers. We're going to put them up on our website and our Facebook page. And what is your address over for your website at Merit?
MeritHealthBiloxi.com.
Where are we headed with this? How much longer is this going to go on? How long is our lives going to be impacted by this?
Well, I've got a really good answer for you. I have no idea.
I think it's when a vaccine is discovered and it's successful and we can do this, V for vaccine.
I think that is a possibility. We are still learning so much about this virus. We don't understand really how it impacts people. We still don't have a handle not just a country, as a world, with how many people will be positive for the infection but are asymptomatic the entire time that they've had the infection.
Meaning you could have it right now, or I could have it right now, but
Potentially.
but we don't have any symptoms.
We don't know, but we're asymptomatic, so we don't know. And the testing availability is so limited still that there's no way for you and I just to get tested. The testing capabilities have been limited to patients having symptoms for the most part. And so as we learn how many people are infected yet asymptomatic, it's going to help us better understand. I don't know where this will go. We're all very familiar with the flu, and the flu has been around for a very long time. We know how that's contracted. We know how people get it. We're going to learn so much more about the coronavirus over the coming months and years, and we'll have a better understanding, just like what we do with the flu. We know what we do with the flu now, right? So we know that everyone's encouraged to get a flu vaccine each year, particularly if you have risk factors. And I think we'll get to that point. But it will be at a point where we have the availability of the vaccine, we understand the effectiveness of the vaccine, we understand the risk factors that contribute to people having serious illness. And as we learn more and more, we'll have a better handle on this. But I don't think the coronavirus is going to go away. I think it'll be with us for a while.
What do you say to people that say, we're just blowing this all out of proportion and it's no more than the flu?
There are a lot of people that say that. I believe that's an uninformed opinion. I do believe that the coronavirus is very serious and we need to take it very seriously. I don't know, though, to the extent of what's the appropriate level of reaction. And until we have more research studies to show us the severity of illness, how it's contracted, who's at risk for getting sick, that it's hard for us to say how serious it really is. But we're taking it very seriously.
Gotcha.
That's the most important thing. And that's the best thing that the entire community can do, is to take this very seriously. Recognize that it is a serious, dangerous threat, but we also have to recognize that the world has to go on at some point.
Speaking of the world going on, you've got this COVID thing, you've taken all these measures and you're focused on that, but you're also doing elective surgeries too. That's a safe environment now.
We are. We've spent a lot of time in preparation and planning to make sure we have the safest environment possible for our patients to come through and have surgery. We've returned back now to where we're doing about 85-90% of the surgeries we were doing before the COVID pandemic began. And so we've had a real nice bounce back in our surgical volumes. Interestingly enough, I've been talking to our surgeons, and there's several levels of surgery. You have low severity surgeries, which are very elective in nature. They may be screening in nature. They may be minor. Then you have the high severity of surgeries, which, they're potentially life-threatening, things that are very concerning. Maybe it's a total hip replacement or a total knee replacement. But then you also have this middle level of surgeries. And what's been really interesting to us is our volumes return for the low acuity surgeries and for the high acuity surgeries. The middle acuity surgeries seem to be delayed still. I was talking with one of our great orthopedic surgeons just this week, and he told me, he said, the month of June, my surgical volume is pretty normal. He said, maybe down a little bit, but he said the month of August is crazy busy. He's already booked completely for the month of August. And we were talking about that may be because the media has just pounded into all of us that, maybe by August everything is safe and okay. But in terms of having surgery now, it is safe to have surgery. What we are encouraging is for patients and physicians to make the best decision for that individual patient. Is this important for the patient to go ahead and have the surgery, or should they continue to delay? And we trust that those decisions will be made very well.
Gets back to that personal responsibility thing and being prudent. Any closing thoughts?
I just want to make sure the community knows how much we care about you. We spend an enormous amount of time in preparation and planning to make sure that we are safe for you to return to care. My most important urging or asking of the community is that they will not delay care if they're having warning signs, that chest pain they're feeling, or dizziness, or headache, or abdominal pain. Putting that care off, not coming to the emergency department and getting that checked out, is exceptionally concerning. We've got a lot of patients that have been coming to our emergency department, and they'll say, when they come in, we're having to admit them to the hospital and they tell us, I've had chest pains. It's just been crushing for 3 days. Well, that's not good. They should have come in on the day that it started hurting them like that. And perhaps they would have avoided being admitted to the hospital. And so that's probably the biggest ask I would have of the entire community is don't ignore warning signs. If you have concerns, we have an emergency department that is carefully planned and designed so that it's a safe environment. The risk of infection of COVID in our emergency department is exceptionally small. You're more likely to get it at a restaurant or
be careful.
in a business. You are, but that's the truth.
Right.
Just because of all the precautions we've taken. I don't want to scare anyone.
Yeah.
It's safe to come, and if you're having those warning signs, please do not ignore those. We care about their health and safety, and it makes me a little nervous that we're seeing some indications that patients are putting off care when they do have those warning signs.
If you don't feel well, don't go to a restaurant or don't go anywhere else. Go to the doctor or to the hospital.
That's absolutely correct.
And preferably merit.
Yeah, absolutely. That's what we would prefer.
Thank you, Tom.
Thank you so much.
Appreciate it. You're seeing more and more businesses expanding hours or services, and you're beginning to see more special events return. In fact, the city announced today that its 4 splash pads are opening to the public beginning Saturday morning. They're going to be open daily from 9 a.m. to 8 p.m. The splash pads are at Hiller Park, Point Cadet Plaza, the Margaret Sherry Library, and John Henry Beck Park. That's our report for today. We'll be back on Monday with a new report. We leave you today, as the Billfish Tournament takes place on Point Cadet this weekend, with a view of Point Cadet Marina during that event in 2017. We'll see you on Monday.